Are you experiencing a catching, sharp pain on your hip groin or sometimes at the butt area due to a labral tear? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be talking about labral tear, how to find if you have it, secondly, how to manage it, and thirdly, how to fix it. You have to realize that labral tear, usually most individuals have it without any symptoms. If you have a labral tear due to a major injury on your hip, it could be many years ago and all of a sudden you start having symptoms right now. There could be some movements, exercises that you're doing that making it worse. If you have a catching, clicking sound on your hip, that could be your labral tear. So what is labrum? The labrum is a cushion that helps support your joint. There's a labrum on our hip and also on our shoulder. That's why there could be a tear on your shoulder or your hip joint. And if you're having difficulty moving your hip and you feel a certain range of motion of difficulty because of the catching sensation, something's catching on your hip joint, then my recommendation is not to push it to the point of pain. Pain makes you weaker and you want to make sure you rest your hip and slowly build the strength, mostly isometrics, before you do a gentle range of motion. And I also recommend not to overstretch. Stretching as much as you can will make it worse. And if you're a ballet dancer, a gymnast, and you're doing high repetition of rotation on your hip, jumping, high impact on your hip joint, you're making it really worse. Of course, I would like you to see your primary care doctor, refer to an orthopedic doctor, have some MRI or X-ray done if you need to see more details about it. Of course, X-ray will show if you have a fracture on your hip joint or on the head of your femur. However, if you don't have positive on your X-ray, my recommendation is to have an MRI, and that's when we're going to find out the different types of labral tear. Anterior tear is the most common, which you find in the front of your hip joint. The pain is mostly on your groin and the front of your hip. Posterior labral tear is mostly at the buttock. If you feel like there's more pain after prolonged sitting or if you've been standing a lot and walking or running. And the anterior hip pain is mostly common for European and American descent, and the posterior tear is most common on the Japanese Asian descent, maybe because of lifestyle, genetics, or whatever factors of repetitions of activities. Thirdly, there's superior lateral tear, which is asymptomatic, is mostly on the top and outside of your labrum. The labrum really helps cushion. It's the area where it helps cushion your hip joint inside and then your femur bone. So without the cushioning, that's when we have wear and tear, fraying through the years as we get older. So that's why my recommendation is to always warm up before you do any physical exercises. If you want to plan to bike, run, or any activities that you need to do, especially if you start lifting weights, it could be full body workout. And if you're not warming up, unfortunately, our joints are usually gets the injury. You can be physically strong on your muscle, but doesn't mean your hip joint is strong. When you feel strong, usually your muscles get stronger faster before your joint. So when you start lifting weights and you're getting too high repetitions, but high number of weights, if you're going heavier and heavier without listening to your body, such as squatting, deadlifting, and activities that could really cause more problem on your hip joint. So how do you know if you have a labral tear? The first thing you have to do is find out. There's a special test, the FADIR test or the FADIR test. This is a test where you lie down on your back. There's someone should be able to put pressure. So with your knees bent 90 degrees, the therapist will slowly pull it in, and then your knee, the injured hip, and then slowly rotate it inwardly, and then your foot goes outward. You're gonna feel a groin pain for a labral tear, which is the anterior portion, which is the most common. So if you're positive on that, of course, MRI is the best way to know how bad is your labral tear. My next recommendation is to rest. Resting is key. You can take some Advil, some anti-inflammatory drugs that will help increase the inflammation. Resting alone will make a huge difference. You can put some ice first, and then if you feel like it doesn't work with ice, even though there's no swelling, heat is great as well to help increase the blood flow. Even though it's more superficial, I know it's deep socket, resting is. And listen to your body. I don't believe in no pain, no gain. I believe on when there's pain is a signal from your area that signals to our brain to let you know that there's something off and wrong. And the more pain you have, the weaker you get. So that's my number one recommendation about any hip joint injury. If you think hip rotation will make it worse, actually doing isometric is our first step. There's 3 steps we're gonna do to help heal you. First, we're doing a lot of isometric in this program, which means we're strengthening without movement. Second, we're going to progress stability. We want to improve your hip stability. So we might need the wall. The wall will be our exercises that will help that beautiful isometric motions. Thirdly, we're going to do some strength training with some resistance. But first, it's all body weight, isometric. And then when there's less pain, that's when we're gonna add more resistance. So let's begin the program now. So we're gonna use a foam roller, and the foam roller will give us some lovely isometric. If you don't have a foam roller, you can use roll towel, or you can use a soft ball or pillows. And in this movement exercises, we're gonna start squeezing and holding. We're gonna target the hip adductors first. So you're gonna lie down on your back. So if you're having dull, nagging pain that doesn't go away, it means it's inflamed right now. So first, we're gonna lie on your back with your knees bent. Place the foam roller between your knees. And you wanna make sure you take a deep breath and gently squeeze the foam roller and exhale. You're gonna feel some deep ache on your groin, but as long as it's not a lot of pain, just a deep, slow activation of your muscles. Hold it for at least 20 seconds. And breathe out. To make sure you incorporate your breath as you breathe in and breathe out. Inhale, exhale. I'm still holding and squeezing the ball. And I'm feeling the fatigue as well, because we don't really target the hip adductors as you squeeze gently. As you inhale, exhale. And I could really feel the fatigue, and I'm getting tired on the groin area, and then relax. As long as there's no pain, just mostly weakness. And then you wanna make sure you gently inhale through your nose as you expand. Just enough pain. I don't believe in no pain, no gain. I believe in slowly building strength, slowly and effectively. Be mindful in your core and also your hip joint. It's always weaker on our joint first before we build, and making sure there's no more pain after you release it. You want to make sure as you inhale through your nose, as you slowly squeeze it. Hold it for 20 seconds. Inhale, exhale, slow and steady without pain. Okay, my friends, now we're going to slowly sit up now, and we're going to target the groin area again, and that's the hip adductor. We might need a wall to support for hip adductors. So if you don't have a wall, you can use any device that you can slowly press against it. So I have a soft foam roller, so it's not really irritating my hip joint. You want to make sure as you gently press your foot, inner thigh and foot on your inner leg towards the wall. As you breathe in, exhale, slowly press against it and hold it as well for 20 seconds. Hold and keep it stable. Try not to rotate your hip out. Keep it in and then let go slowly. As you breathe in through your nose, exhale as you gently press, and do that as well 10 repetitions. You want to make sure there's no pain, and you want to make sure you rest in between. Now we're going to cover the outside of your hip joint, and it's important that you don't do the 90-90 position to stretch your hip groin. Overstretching is really bad for your pelvic floor. Always remember that when you have a strain or a tear on your, especially the anterior part, when you lift it up, you're overstretching it. And when you have an inflammation, it's best not to overstretch and exercises to stretch and mobilize it. Problem with the labral tear, when you start, feels good, but after the deep stretch, you're going to feel a lot of problems. So you want to make sure when you do your stretching, it's like a labral tear on your shoulder. You don't want to overstretch the area. You want to improve the stability. Now we're going to cover the outside of your hip. So we're going to use the wall again and the foam roller against the wall, and you're going to keep your knee straight, keep it stable, and keep your spine straight. And you're going to gently press your outside of your leg with your foot, pressing against it, focusing on your hip joint, and you hold it for 20 seconds as well, keeping your core engaged as you breathe in and breathe out. Inhale, exhale. And you do that as well for 10 repetitions. You want to make sure when you do this, you do it gently, not to the point of pain. We're slowly improving the stability of your hips. Okay, my friends, now we're going to try to further build strength by doing a gentle range of motion now, which means a simple rotation of your hip joint, not to the point of full range of motion, just a little bit internal rotation, and keeping that 6-inch foam roller underneath your leg as you rotate it in and out, just a gentle range of motion mobilization. You want to make sure it's not to the point of pain, just enough to feel the stretch, and keep it stable on your groin. If you notice, I'm not really rotating it fast. I'm slowly pushing it out and then in, and hold it for a few seconds. Hold as you breathe in and breathe out. And hold it there for a few seconds, up to 20 seconds hold if you can. If there's any pain, always remember that pain makes you weak. You want to make sure to the point of you feel the stretch and the strengthening, and you might feel shaky with a little bit internal rotation, and hold it for 20 seconds times 10 repetitions. Slowly progress up to 20 seconds. Okay, my friends, now we're going to slowly build strength. After a few weeks, after 2 to 3 weeks of doing those exercises, now it's time to strengthen by doing bridging. Okay, my friends, now we are progressing with bridging. With double leg bridging with your feet down on the floor is actually too much for a labral tear. Inflammation on your left labral tear. Make sure you lift the injured side and focus on the good hip, which means as I lift both hips up and extend the opposite leg, even though we're not putting any weight on your left labral tear, it's actually building strength. So you want to make sure you start with your knee bent first, and you can progress with extension and really challenge that. When you extend your leg, it's really targeting the deeper muscles all the way to your hamstrings, and then slightly bend your knee and down. You want to make sure you feel good on your hip. There's no clicking, there's no pain. When you target the right side of your hip, if that's the good side, you're actually transferring mirror effect on your left hip. So as you do that, you want to make sure you take a deep breath, exhale, lift, extend your leg, your knee, and then down. And do that 10 repetitions as well. So after you do that, 2 to 3 weeks after performing that, now we can glue them and further strengthen your core and your hip flexors. Place the foam roller between your knees. You're going to target the deeper muscles again as you lift both legs up while squeezing your knees together as well as your feet. So the foam roller is long, so it covers from your feet all the way to your knees. As you squeeze them together and lift both knees up. As you breathe out, inhale as you gently tap your feet, and then exhale as you slowly lift. Inhale, exhale. And do that 10 repetitions for beginners, and slowly progress to 2 sets of 10. You want to make sure you do it slow and steady, not rushing, and feel your core muscles engage, and there should be no pain on your hip joints, especially the area where you have the labral tear. You want to transfer and gluing them together at the same time, building the isometrics of your hip joint with core stabilization, building your abdominal muscles, your hip flexors that will support your labral tear. Everything in our core muscles will actually be the powerhouse of our body. That first, number one, we don't want to do too much stretching. We don't want to overstretch the area. We want to build stability. And now we are gluing them together. You have to wait for a few more weeks before you progress. Always listen to your body. If there's a lot of inflammation and pain, stop. You can always go back to the beginners. And that's why each one is unique on building strength. You don't want to overdo your core strengthening as well as your hip stabilization. As you lift, if there's any pain on your back and your hip joint, then that's too much. You can always start single leg first and really do the isometrics. But the gluing together helps improve the stability of your hip joint. And you want to do it slow and steady with proper breath work and core engagement. We have 2 more to go, and do this 2 sets of 10 if you can. Okay, my friends, now we are progressing further with more stability by extending your leg. So when you extend your leg, it's a lot more on your core and your spine. So you want to make sure you wait for another 1 to 2 weeks before you progress with double leg raises with the foam roller, keeping it stable. So I'm placing the foam roller further back. So the further it is, the harder it is as you lift and breathe out. You don't want to hold your breath. When you hold your breath, as you gently squeeze the foam roller, it really activates our deeper core muscles. So as you inhale, exhale as well as you go down. Try not to plop your feet as you exhale. So slow and steady, eccentric control. As I said, there should be no pain on your hip joint. Everyone is different on their progression. You want to make sure when you're doing this, you're stable, you're not plopping your feet. You are just slowly incorporating one breath, one motion. As you inhale, relax first and gently squeeze as you exhale, and then slowly lift it up as you breathe out, and then breathe in again, and then exhale as you slowly lower your feet down and exhale. So that's how you do it. You can do 2 sets of 10, but if you're absolute beginners, even 5 repetitions is a great start already. Okay, my friends, the next progression after 1 month of no more inflammation, now we can do some standing exercises. You will need the wall to support our core and our hip joint, and you can also use the foam roller for stability. So I'm standing on my right foot. If my problem side is my right labral tear, I'm gonna weight bear now on my right side. If there's pain and weight bearing on it, then stop. Then you should continue what we were doing earlier. So I'm focusing on your right. I'm using the foam roller as support, or you can use a wall. And then you're going to slowly shift your body weight on the bad hip joint. Use the foam roller for stability, especially if you're absolute beginner. And we're going to do a single Romanian deadlift, RDL. So for absolute beginner, instead of lifting your foot all the way up, you can step back gently. So if my problem side is my left, I'm leaning on my left and I'm stepping off towards my right and really activating my left glutes and slightly leaning my body forward. And you can hold it for 5 seconds and slowly progress to 30 seconds as long as there's no pain. 30 seconds is for advance, and there should be no pain as you gently lean forward as you exhale and balance. And this is good. So when you have instability with your balance, you really need something to hold on, like a wall or the foam roller. As you breathe in and breathe out, tap. And then slowly progress now with leg extended all the way up as much as you can to level with your foot. So my foot is up and level to my hip, and then do a gentle hip flexors activation. So I'm focusing on my left, but I'm kicking with my right. If my left is my labral tear, that's where I'm going to focus. And then I'm softening my left knee to give that extra core engagement. At the same time, my hip muscles are engaged. If your knees are straight, sometimes you're locking your knee. When you're locking your knee, you're using your joints. But when you soften your knee, you're really using your hip muscles as well as your hamstrings and your quads. Inhale, exhale, extend, and hold this for absolute beginners, just 2 to 3 seconds, then progress to up to 10 seconds hold. The hold is so important to improve the stability if you have a labral tear. And there should be less pain now on your groin as you keep doing this. Slow and steady, feel your muscles, making sure there's no increasing pain. If you have increasing pain doing this, then slowly, then stop and don't challenge. But if there's no pain and you can let go of the foam roller, try and feel it first. So if your balance is improving, that's progression. Now you can slowly lean without the foam roller, without the wall. But if you feel unsure of yourself, you can always have the wall beside you for support or the foam roller. And you want to make sure when you do this, there's no pain. Okay, my friends, now let's do side-to-side lunge. Side-to-side lunge is one of the best tools. So you side lunge and then kick to the side, and you do it in both sides. This helps strengthen your pelvic floor and your labral tear. Slow and steady. As I said, there should be no pain. If holding on the foam roller is challenging, you can lower it down as well for stability for absolute beginner, or you can use a table or a chair, side lunge and side kick. If side kick is too difficult, you can start just simple side to side lunge for now. And that really targets our hip joint. There should be no clicking pain. There should be a gentle feel of a stretch and engagement on your groin muscles. If the pain level goes up higher to 3 or 5, then you're overdoing it. It should be. This step-by-step guide from beginners takes weeks and months, sometimes up to 3 months for those absolute beginner. So as you progress with the side lunge, you want to make sure you can slightly lean forward so you're activating your glutes. So try to listen to your body, try to perform these exercises even 3 times a week, and then slowly progress to every single day to keep the labral healthy, mobile, and flexible. If you have any questions, leave a comment down below, and if you need my help and guidance, you can join my one-on-one coaching of my back masterclass so I can hold your hand and guide you if you're suffering from back pain, weak core, poor posture, and if you have some instability of your pelvis and your hip joints. Okay, my friends, we are going to cool down now, and it's important to cool down properly after the standing exercises. So we will need to go back to lie on your back, and now you can slowly strengthen further. If there's no more pain in standing, you can now do the double leg bridge, and that's how you cool down properly. Once you feel that stability is improved, there's no more pain, then you can do the double leg bridge. And you want to make sure you know if you really have a labral tear. So as I said, see a doctor first, have some MRI, measure how much tear you have before you proceed in any exercise program recommended by your physical therapist and your local doctor. You want to make sure you've been seen properly before you do any exercises. But I've been using these exercises to all of my patients with labral tear, and if you need my help and guidance on building strength on your core muscles and your spine, even your hips is part of your core, I can hold your hand and help you with your back pain, and you can book a free call, one-on-one coaching with my core back protocol inside my back masterclass. So click the link down below and I'll slowly help you. If you need my help and guidance and you want to learn more about Pilates, yoga, physical therapy, please subscribe to my channel, ring the bell so you won't miss anything, like and share this video. Every like you're giving to my channel, you are helping me. And if you have more time today, I have a video over here about the quadratus lumborum pain and one-sided weakness, and a video over here about knee pain injury. Until next time, always remember, be safe, be well, healthy you. Bye!